much responsibility do patients have, do black people, dark-skinned people have for this situation, for these lower survival rates, okay? 80% on average, of white Americans have trust in their doctors, their primary care physicians, medical practitioners, okay? 43% of black Americans. I get the distrust. Nat mentioned experiments. There's so many. The most common one that people talk about is the Tuskegee syphilis study, where between, I think it was 1933 and 1972, I was 12 years old in 72, they were injecting black patients with syphilis without their knowledge, just to experiment on them. Your bodies, and we're going to inject syphilis in you, and then we're going to watch and see what happens. It's like, that's probably as close to evil as you could ever, that's pretty evil, okay? If I can use that term. That's a hard term, but I'm going to use it, okay? Things have changed since 1972. Things have really changed. And while you might have a conspiracy orientation that stuff is still going on, be very careful about those YouTube videos that you're watching and things that you're reading and things that your Uncle Delbert tells you about white people and the white system. Because maybe your Uncle Delbert has been watching too many bizarre YouTube videos from I don't know where. And so you have a responsibility to be smart about these things. So, when black people under COVID, and so a much higher rate, black people at a much higher rate were saying, hey, we're not going to get this vaccine because, what white people do in the system and Tuskegee and the syphilis study, and we don't trust vaccines. And I think, well, mind you, remember black people, I'm making an argument here. So Nat's going to push back against it, right? Because this would be an argument that would be much more typical of somebody who would be saying, you have to take some responsibility for yourself. You cannot just sit back and blame the system for all of the problems. The system, racism, white people, it's like, no, that's fine. You can talk about the system, but you have to also take some responsibility for yourself. And what that means is you have a responsibility then to go out and try to understand what is actually going on in the world and not just listening to your Uncle Delbert postulate all of his racist theories about white people and experimenting on black people. So under COVID, black people were so much more willing to question about, vaccines. And there are people in this building and next door in life sciences who've been studying, they've been studying vaccines, these mRNA vaccines and so on, their whole lives. We knew so much about these vaccines. And so I know some of you are probably anti-vax and okay, great. How did you get to your anti-vax perspective? Did you talk to scientists who have been studying this their whole lives and they really, really understand how this stuff works? They've been developing this vaccine for over a decade and they didn't just come up with this. Or were you watching YouTube videos? And if you were watching YouTube videos, then I would say, well, in fairness to science and in fairness to your own intellectual growth and development, you do have a responsibility to go read what some of the scientists are saying and then assess. And if you didn't do that, then okay, well then you can't say that you know about vaccines. Because these are not people who are here out just trying to hurt you. These are very, very smart, thoughtful people. So, message back to black people. You can't just call in the syphilis study every time you want to turn around and question the healthcare system. You can't just do that. The study's over. Things have changed. We're not doing those experiments on people. Maybe we are. Maybe there's it's happening out in the desert outside of Las Vegas, right? Area 51? I don't know, where they keep Martians and stuff. But you also got to take some responsibility for not having trust in the medical establishment. Just because your grandmother doesn't trust and your father doesn't trust and you just believe them that doesn't make it okay. Just because they said it. You know what I mean? So it's just like in this classroom, which is why the three of you are up here. Just because I say it doesn't make it okay. You have to think on your own. Okay, so what I'm going to say is on the trust issue, yeah, Black people, come on. You got to it's not, take some responsibility, because the trust issue means that you're going to be less likely to go get a checkup. That means if you have skin cancer or a skin problem, it's already going to be far more advanced than when it finally shows up, because you were distrustful and you're like, I don't trust these people. It's like, who are these people? Who are you talking about, right?
I agree that we are responsible for going to our own checkups and keeping all that in track. But at the same time, there is a reason for the distrust.
Okay.
So it doesn't come from nowhere.
Yep.
If white people or science or any of that was good to us from the beginning and we had no issues going to the doctors or anything like that, this distrust wouldn't even be a thing. So I feel like, honestly, white people make a lot of the problems and then complain about the problems and act like it's coming out of nowhere.
And act like you're
you complain
responsible.
Too much.
No, I got you. So
you made it a thing.
Yeah, exactly. By the way, white people, what she just said right there is really, really, really important. We create these things. So many things happen. The inequality. Black and brown people didn't create the inequality. Native Americans aren't the poorest ancestry group in the United States because of Native Americans. Native Americans are the poorest ancestry group in the United States because of the policies that were constructed by the U.S. government, mostly white people, almost entirely white people. Okay, and then to turn around and point fingers at Native Americans and say, you need to fix this problem. What's wrong with you? Well, hang on. We created it, but there's a point in time. So this is this thing. So the two of you ready? I want you to weigh in on this. There's this little bit of a tug-of-war. So if you talk to people and this includes black people, by the way, the most conservative places the most conservative place in the United States, and I mean conservative, man. Do you know where it is? Do anyone have any idea? It's a black church. You go to a black church, there's a singular message. It is not about the white man. There are a few, but the vast majority of black Christian churches, the singular message, it's powerful, it's resolute, and it's straightforward, is take care of yourself, stop complaining, pull yourself up by your bootstraps. If you did wrong, take responsibility for it and do better next time. And stop pointing fingers at other people. You're the problem. It's not the police. It's not the job that just fired you. It's not this. It's not that. Pull yourself up and move forward. Yeah, you experience racism and you experience this, but man, that black church message, and I feel like the message, there's almost like a way in which sometimes for white people it benefits us to not hear that and not really understand that, because it almost like it allows us to be lazy in our own way unless we have really close black friends. And we realize that the vast majority are black friends. And the vast majority, I don't know, maybe I'm out speaking, but how much conservative thinking exists in the black community, right? So the tug-of-war here is, I hear you, I understand, it does come from somewhere, but at some point in time, you gotta say, but I have to trust. I have to move forward. I still have to go check up on my skin. I may not trust. I got this trust. It's been in me, for you, right? It's like in your DNA. But imagine being my age and have 62 years of distrust. But still, at some point in time, you got to break through that. And so that's okay. So, go ahead.
It could also be a cultural thing too, because my parents believe more in, we use medicine too, but we also believe in other forms of medicine, not just ibuprofen and what the doctor gives you. And that's probably from their country in Haiti. Yeah. So there are a lot of other countries that think different herbs and teas and stuff like that are better for your health than like what the doctor gives you.
Totally. Yep. As the two previous classes, our Nigerian colleagues here, go and look in Nigeria, go to Haiti, man. When I'm pushing back on this, saying that, okay, but you got to take some responsibility here a little bit, where does your mind go? What do you hear?
I mean, like, you were the one that showed us the statistic that, like, as a white individual, we have like a 90% survival rate, whereas someone who's colored only has a 66% survival rate. So how could you look at a medical professional and fully trust them if the numbers aren't the same?
Okay, but listen, because you're not thinking. But one of the big reasons why the rate is lower for people that look like me is because by the time I show up to see my doctor, this disease is already, advanced so far that it's a problem. So, like, okay, so therefore, I got to take I need to get on this. By the way, I'm saying this. This is a PSA to those of you who are more darkly pigmented, by the way, and have a distrust. So, yeah, that would be the reason.